This is one of my favorite mnemonics. I always use it in the clinical practice, and I also see other people use it. It helps you quickly come up with differential diagnoses and look for problems. If for any reason somebody asks you about a specific area or a specific issue, for example, somebody having problems swallowing, think of vitamin. This will give you a differential diagnosis that is so wide but also specific. So V for vascular problems. So like we said, somebody is having problems swallowing and they ask you about differential diagnosis. V, the vascular problem. Think of the vascular issues in the esophagus. The first thing that should come to mind is esophageal varices. And this should be one of your differential diagnoses. So you would ask the patient if they would have symptoms of liver failure, which would cause esophageal varices. Also, you would ask them if they have symptoms of esophageal varices, such as vomiting large amount of blood. And this applies elsewhere as well. So for example, if somebody is asking about headache symptoms, and they ask you for the differential diagnosis, the V in the vascular would stand for aneurysms, for example, or hypertension, or any vascular issue in the brain, and so on. I for inflammatory, and this can be infectious or non-infectious. The most common cause of inflammation anywhere in the body is, of course, infections. But inflammation can also happen due to autoimmune disorders. So for the patient who's having problems swallowing, the I could stand for inflammation or autoimmune disorders, such as achalasia. T for trauma or toxins. The trauma in the esophageal area is most likely due to ingesting liquids or sharp objects. And so you would ask about these in the patient. And the toxins are, for example, botulism. A for autoimmune, and this can overlap with inflammatory disorders, except that not all inflammatory disorders are autoimmune, and not all autoimmune disorders are inflammatory. For example, Graves' disease. It's an autoimmune disorder, but it does not cause inflammation. M for metabolic, and think of the electrolyte disturbances especially. Having certain electrolytes like potassium or calcium, these have a very narrow window, and once they increase or decrease even slightly, the patient will quickly develop symptoms. I for idiopathic, which means that we do not know the cause, and N for neoplastic, which is basically tumors. And this can be a good answer for pretty much anything. So if somebody having problems swallowing, there could be a tumor in the esophagus preventing the swallowing process, or somebody having chronic headaches, there could be a tumor in the head. And of course there are some associated symptoms, but this just gives you a differential diagnosis and a general idea. So if ever somebody asks about the diagnosis and you feel trapped and you cannot answer, just simply think of vitamin. Use the link below to get access to the full Mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other